After a cancer diagnosis, food can become surprisingly stressful. One person tells you to eliminate every gram of sugar. Another says you should stop eating carbohydrates. Someone online recommends fasting before treatment. And another video claims that a certain fruit, tea, or supplement can destroy cancer cells. The advice often sounds scientific, but some of it can leave a person eating too little, losing muscle, and becoming weaker at the exact time their body needs support. In this video, we are examining 7 common cancer nutrition myths, especially important for adults over 50. For each myth, we will explain why people believe it, what the evidence actually suggests, and what a safer, practical approach may look like. Stay until the end because we will also cover 4 nutrition priorities that may help someone maintain strength during treatment. This video is for general education. Cancer nutrition depends on the cancer type, treatment, symptoms, medications, and medical history. Major dietary changes should always be discussed with the oncology team or a registered oncology dietitian. Let us begin with one of the most frightening food claims on the internet. You may have heard this statement: "Sugar feeds cancer, therefore removing sugar will starve the tumor." It sounds logical because cancer cells use glucose for energy. But the statement leaves out something important. Healthy cells also use glucose. Your brain, muscles, and organs all require energy. Even when someone removes bread, rice, fruit, and other carbohydrates, the body can still produce glucose from stored energy and other nutrients. In other words, removing every carbohydrate does not selectively starve cancer cells. This does not mean that unlimited sweets, sugary drinks, and highly processed foods are helpful. Reducing excessive added sugar can be a sensible part of a balanced diet, but that is very different from becoming afraid of every food containing natural carbohydrates. Fruit, beans, lentils, whole grains, and starchy vegetables can provide energy, fiber, vitamins, and minerals. During treatment, easily digested carbohydrate foods may also be some of the few foods a person can tolerate when experiencing nausea, mouth pain, or appetite loss. The real danger is not eating one piece of fruit. The greater danger may be restricting so many foods that the person no longer consumes enough energy. Limit excessive added sugar when possible, but do not automatically eliminate fruit, beans, whole grains, or other nourishing carbohydrate foods. The goal is to obtain enough energy from foods the person can safely tolerate. Cancer and its treatment can change nutritional needs and contribute to poor intake, weight loss, and malnutrition. Now, the next myth is appealing because it offers something everyone wants: one simple answer to a complicated disease. Broccoli sprouts, green tea, berries, turmeric, garlic, tomatoes. You have probably seen at least one of these foods described as a cancer killer. Many nutritious foods contain natural compounds that scientists study in laboratories. A compound may influence cancer cells in a laboratory dish. It may produce an interesting result in an animal study. But this does not automatically mean that eating the food will destroy cancer inside the human body. The concentration used in a laboratory may be much higher than the amount a person could obtain from a normal serving. Human digestion, absorption, metabolism, cancer type, and treatment all influence what happens inside the body. This is where many dramatic online claims go wrong. A preliminary laboratory finding becomes, "This food kills cancer." That conclusion is usually far too strong. Vegetables, fruits, legumes, whole grains, nuts, and other nourishing foods can still play a valuable role. But their value comes from supporting overall nutrition, not from acting as a secret replacement for medical treatment. Eat a variety of nutritious foods rather than depending on one supposedly powerful ingredient. Different foods provide different nutrients. No individual fruit, spice, vegetable, or drink should be presented as a guaranteed cancer treatment. There is no proof that popular diets or dietary supplements can treat cancer, although a balanced diet remains important for general health. The next myth creates a different problem. It assumes that every person with cancer should follow exactly the same eating plan. Imagine 2 people receiving cancer treatment. The first person is eating normally, maintaining weight and experiencing few digestive symptoms. The second person has severe nausea, mouth sores, and rapid unintentional weight loss. Should both people follow the same diet? Of course not. Cancer nutrition must be personalized. The best approach can depend on the type and location of the cancer, the treatment being used, whether surgery has affected digestion, the person's weight and muscle mass, kidney, liver, heart, or blood sugar conditions, and symptoms such as diarrhea, constipation, vomiting, swallowing difficulty, or changes in taste. For example, high-fiber foods are normally part of a healthy dietary pattern, but someone experiencing certain bowel problems may temporarily be advised to eat less fiber. A large raw salad may be nutritious for one person but painful for someone with severe mouth sores. A person losing weight may need energy-dense foods that do not look like a perfect social media meal. During treatment, the healthiest choice is sometimes simply the food the person can swallow, digest, and keep down. Do not force a universal cancer diet onto every patient. Match food choices to the person's treatment, symptoms, and nutritional condition. People undergoing treatment may temporarily require eating patterns that differ from what is normally considered a healthy diet. The next myth can be particularly harmful for people over 50 because it involves something they cannot afford to lose too quickly: muscle. Many adults want to lose weight. Because of this, unexpected weight loss during cancer treatment may initially look like a positive change, but treatment-related weight loss is not necessarily healthy fat loss. A person may also lose fluids, muscle, and essential nutritional reserves. Imagine someone who has already lost several kilograms because eating has become difficult. They may notice the number on the scale falling and believe the treatment is helping them become healthier. But at the same time, they may be struggling to climb stairs, walk normally, or complete daily activities. That lost weight may include muscle. Muscle supports balance, movement, independence, and recovery, especially after the age of 50. Warning signs can include clothing becoming loose within a short period, feeling weaker while walking, eating much less than usual, feeling full after only a few bites, or becoming too tired to prepare food. These changes should be reported early. The longer someone waits, the more difficult it may become to restore their nutritional condition. Do not intentionally pursue weight loss during treatment unless the medical team specifically recommends and supervises it. When appetite is poor, smaller meals may be easier than 3 large plates. Protein-containing foods such as eggs, yogurt, fish, poultry, tofu, beans, or nut butter can help increase the nutritional value of meals, depending on what the person can tolerate. Cancer-related malnutrition and weight loss can be associated with poorer outcomes and more severe treatment complications. The next myth is often described as cutting-edge science, but for someone already becoming weaker, it could add another serious problem. Fasting receives enormous attention online. Some people claim that avoiding food before chemotherapy can protect healthy cells or make treatment work better. Researchers are studying fasting and fasting-like approaches in selected groups of patients, but research being studied is not the same as a universal recommendation. Cancer is not one disease. Treatments are different, patients are different, and nutritional conditions are different. Someone who is maintaining weight and being closely supervised is not the same as someone who is already losing muscle, vomiting, or becoming dehydrated. For the second person, prolonged fasting could make an existing nutritional problem worse. It may be particularly risky for people with diabetes, frailty, low body weight, or medications that are affected by food intake. A short video cannot determine whether fasting is safe for a particular patient. Do not begin prolonged fasting, severe calorie restriction, or a fasting mimicking diet during treatment based only on online advice. Ask the oncologist and an oncology dietitian whether any form of fasting has evidence and is safe for that specific situation. Popular diets should always be discussed with the healthcare team because there is no proof that they treat cancer, and individual risks can vary. Now we come to a myth that can appear harmless because the products involved are sold without a prescription. The word natural creates a feeling of safety, but natural does not mean inactive. Herbal extracts, concentrated antioxidants, and high-dose vitamins can affect the body. Some may alter blood clotting. Some may influence blood sugar levels. Others may change how a cancer medicine is absorbed, processed, or removed from the body. The risk depends on the product, dose, treatment, and individual patient. There is also an important difference between eating a nutrient as part of food and taking a concentrated dose in a capsule. A normal serving of food may contain a modest amount of a nutrient. A supplement may contain many times that amount. More is not automatically better. And a product does not become safe simply because it is sold in a health food store. Many patients also forget to tell their doctors about supplements because they do not think of them as medicines. That can make potentially important interactions harder to identify. Make a complete list of every supplement, powder, herbal remedy, and medicinal tea being used. Include the exact product name, dose, and frequency. Show the list to the oncology team or oncology pharmacist before starting or continuing the products. Dietary supplements and herbs may interact with cancer drugs and alter how those medicines work in the body. The final myth creates guilt at a time when patients already have enough to manage. Cancer treatment can change appetite, digestion, smell, and taste. A person may enjoy a balanced meal one day and struggle to eat anything the next. On a difficult day, the only manageable option may be soup, toast, yogurt, mashed potatoes, or a smoothie. That does not mean the person has failed. Nutrition during treatment is not a competition for the cleanest plate. It is an adaptable process. When nausea is severe, smaller meals and foods with less smell may be easier. When the mouth or throat is painful, soft and moist foods may be more comfortable. When diarrhea develops, the medical team may temporarily change fiber recommendations. When food tastes metallic, changing utensils, seasonings, or food temperature may help. The best diet is not the one that looks perfect in a photograph. It is the one that provides enough nourishment while adapting to what the patient can actually eat that day. Aim for progress rather than perfection. Take advantage of better appetite days and use simpler, tolerated foods on difficult days. Report symptoms early so the healthcare team can help before eating becomes nearly impossible. Different food strategies may be needed for symptoms such as swallowing difficulty, appetite loss, vomiting, and mouth problems, because nutritional needs can change throughout treatment. After separating the myths from the facts, what should someone actually focus on? Here are 4 practical priorities. Protein helps the body maintain and repair tissues. When protein and overall energy intake are too low, the body may break down muscle. Try to include a tolerated source of protein throughout the day. This might be eggs, yogurt, fish, chicken, tofu, beans, lentils, or nut butter. The exact amount depends on the individual, particularly when kidney, liver, or digestive problems are present. The goal is not to force a huge piece of meat onto every plate. The goal is to find protein sources the person can comfortably eat. Protein is an important nutrient for tissue repair and maintaining strength during treatment. When appetite is normal, meals can include whole grains, vegetables, fruits, protein, and healthy fats. When appetite is poor, smaller and more energy-dense meals may be more practical. Adding yogurt, olive oil, avocado, cheese, powdered milk, or nut butter to suitable meals can increase energy without requiring a much larger portion. The specific choices should be adapted to symptoms and medical guidance. Vomiting, diarrhea, fever, and difficulty swallowing can increase the risk of dehydration. Water may be enough for some people. Others may need soup, milk, oral rehydration drinks, or another option recommended by their healthcare team. Seek medical advice if the person cannot keep fluids down, urinates very little, becomes dizzy, or develops unusual confusion. Some cancer treatments weaken the immune system, making foodborne illness more serious. Wash hands and preparation surfaces. Separate raw foods from ready-to-eat foods. Cook foods thoroughly. Refrigerate leftovers promptly. And follow any additional food safety instructions provided by the treatment center. Do not wait until the next routine appointment when someone is losing weight quickly, cannot keep food or fluids down, has difficulty swallowing, experiences persistent vomiting or diarrhea, feels dizzy or unusually weak, has mouth pain that prevents eating, or is eating far less than normal for several days. Early nutrition support is usually easier than trying to correct severe weakness and malnutrition later. Once acute treatment is complete and eating becomes easier, many people can gradually return to a balanced dietary pattern. That usually means eating a variety of vegetables, fruits, whole grains, beans, and appropriate protein sources, while limiting highly processed foods, sugar-sweetened drinks, and processed meat. But even after treatment, recommendations may need to be adjusted according to digestive changes, medications, weight, and other medical conditions. After the acute stage of treatment, Many cancer survivors may be able to follow general cancer prevention recommendations unless their healthcare team advises differently. Cancer can make food feel confusing, but fear should not make eating more difficult. Do not eliminate entire food groups because of a dramatic internet claim. Do not begin fasting because one study sounded promising, and do not assume that a natural supplement is harmless. Focus instead on 4 essentials: enough protein, enough energy, enough fluid, and foods the person can safely tolerate. Food does not replace chemotherapy, surgery, radiation, immunotherapy, or other medical treatment. But good nutrition can help protect the strength a person needs to cope with treatment and recovery. The goal is not a perfect diet. The goal is safe, adequate, and personalized nourishment. If you found this video useful, subscribe for more evidence-based nutrition guidance for adults over 50. And tell us in the comments, which cancer nutrition claim would you like us to examine next?